Hello and welcome to the program. I am Suren. Let us talk about the disorder that affects a person's ability to think, feel, and behave clearly, and see if we are able to assist many others affected by it in a wider scale. In fact, the exact cause of this disorder is not really well known at this stage. But research and study continue. However, a combination of genetics, environmental situations, and altered brain chemistry, as well as its structure thereof, may play a great role. And this disorder is called schizophrenia. Schizophrenia is characterized by thoughts or experiences which seem out of touch with reality. Certainly, extremely disorganized speech or behavior patterns and decreased or lesser participation in daily activities. There is always an observable difficulty with concentration with this infliction on the part of the person experiencing it, and memory loss may also be present. The treatment is almost always lifelong and often includes involving a combination of medications, psychotherapy, and coordinated specialty care services. What are the obvious symptoms, you might ask, and which requires a medical diagnosis? Good question. Okay, this disorder is characterized by thoughts or experiences that seem out of touch with reality, as we have mentioned before. Let us then examine what may be experienced. To start, let's observe some behavior patterns. Social isolation. Disorganized behavior, aggression, agitation, compulsive behavior, and thought patterns. Excitability, hostility, repetitive movements, actual self-harm, or lack of restraint. There is also some cognitive decline. There are other thought disorders, delusions, amnesia, beliefs that an ordinary event has special and personal meaning, and believing that those thoughts are not one's own. Disorientation, mental confusion, slowness, inactivity, or false belief of superiority. With this condition, I will repeat once more. A thought disorder, delusion, amnesia, the person experiencing it believes that an ordinary event has special and personal meaning for one's self, and that thoughts are not belonging to oneself, particularly. Thus, the presence of mental confusion. What about the mood swings? Anger, anxiety, apathy, feeling detached from self, general discontent, loss of interest or pleasure in normal everyday activities, but extraordinarily being interested in sexual activity even with animals, elevated to mood disorders or inappropriate emotional responses. Psychologically speaking, hallucinations, paranoia, hearing voices without them being present, depression, which is constant, fear without any reason, persecutory delusions, or even religious delusions, adherence to extreme cultist fanaticisms, for example, altered speech patterns, circumstantial speech patterns, incoherent speech patterns, rapid and frenzied speaking, or speech disorders. Also, commonly observable patterns, such as fatigue, which is constant, impaired motor coordination, lack of emotional responses, or memory loss, which is extreme and very apparent. What kind of experiences people may have? Well, we have already spoken about behavioral, cognitive, and mood swings, as well as psychological disorders and speech-related issues. Let us have a typical overview of this condition, shall we? Schizophrenia is a very serious mental health condition that affects how people think, feel, behave, resulting in a mixture of hallucinations, delusions, and disorganized thinking patterns and behavioral states. Hallucinations considered herein may involve seeing things or hearing voices which are not observed by others. The delusions involve extreme and firm beliefs about things which are not present and true. These need to be completely studied and experienced in observing by trained professionals who have the knowledge to do so. Remember, people with this condition, meaning schizophrenia, may seem to lose touch with reality, which can make daily living very hard for themselves and others living with them. People with schizophrenia would need lifelong treatments. This will include medicines, talking therapy, and helping in learning how to manage the daily life activities. Many people with schizophrenia may not know that they have a mental health condition and may not believe they need any treatment. Many research studies have examined the results of untreated psychosis, which is one of the related issues. People who have psychosis, which is not treated, often have more severe symptoms, more hospital stays, poor thinking and processing skills, as well as social outcomes, injuries, and even death. Remember, early treatment often helps control symptoms before serious complications arise, making the long-term outlook better. Let's go back to the symptoms for a while. Schizophrenia involves a range of problems in how people think, feel, and behave, unusual sexual behaviors included. Let's consider some of the common symptoms. Once more, before furthering. Delusions. This is when people believe in things that are most certainly not real and not proven or true. People with schizophrenia would often think that they are being harmed or harassed when they are not at all. They may even think that they are the target for certain gestures or comments when they are not. They may think they are very famous or have great ability when that is not the case. They may feel that a major disaster is about to occur when that is not true. Most people with schizophrenia have almost always delusions, hallucinations. These usually involve seeing or hearing things that are impossible to observe by others and can be tested. For people with schizophrenia, these things seem real when they are not. Furthermore, hallucinations can occur with any of the senses. Particularly, hearing voices is the most common one, along with unusual sexual appetites. Disorganized thinking and speech patterns. Disorganized speech causes disorganized thinking. And that is a fact. It can therefore be extremely hard for people with schizophrenia to talk with other people. The answers people with schizophrenia give to questions may not be related to what is being asked or considered. Or the questions may not be answered fully. Though rarely, speech may include putting together unrelated words in a way that cannot be understood. Sometimes this is called the word salad. It actually is an extremely unusual motor behavior which is always disorganized. This may show in several ways, from childlike feelings to being agitated for no apparent reason. Their behavior is not focused on a goal, and for them, it is very hard to do any daily tasks. People with this condition may not want to follow any type of instructions. They may move in ways which are not typical or not appropriate within the social setting. For instance, walking on the rooftops or climbing trees as if they are birds on the top of the branches, or not moving much or responding to anything at all. And now, let us observe some of the negative symptoms. People with schizophrenia may not be able to function in the way they could before their illness started. For instance, they may not bathe or wash themselves for a long time, or even have forgotten how to. Making eye contact is another sign, or showing any emotions. They may speak in a very monotonous voice and not be able to feel pleasure or emotions. And in addition to this, they may lose interest in everyday activities, socially withdrawing, and have a hard time planning anything ahead. Symptoms can be variable in type and depending how severe they are. Sometimes, as observed, symptoms may get better or worse. Some symptoms may be present at all times, particularly in unusual sexual pleasures or behavior patterns. People with schizophrenia usually are diagnosed in the late 10 years of age to early 30s. With men, schizophrenia symptoms usually start in the late teens to early 20s. With women, symptoms usually begin in the late 20s to early 30s. There is also a group of people, usually women, who are diagnosed later in life. It is not common with children to be diagnosed with schizophrenia. What about the symptoms in teenagers? That's a good question. Schizophrenia symptoms in teenagers. They are like those in adults, but the condition may be harder to pinpoint. That is because some early symptoms of schizophrenia, those that occur before hallucinations, delusions, and disorganization, again particularly in sexual unusualness, are commonly seen in many teens. Withdrawing from friends and family. Not doing well in school. Having trouble sleeping. Feeling irritable and depressed all the time. Lacking motivation. Using recreational drugs, such as marijuana. Indulging in stimulants like cocaine or mind-altering drugs or hallucinogens can cause similar symptoms. Compared with adults suffering schizophrenia, teens with the condition may be less likely to have delusions and more likely to have hallucinations. Then, when is it proper to see a professional, a doctor? Well, people with schizophrenia often do not know that they have a mental condition which needs medical attention as soon as possible. As a result, family or friends often need to get them help. Helping those who may have schizophrenia. If you live with some people, or if you know people who have symptoms of schizophrenia, attempt to talk to them about your concerns, if you can get through. While you cannot force them to seek help, you can offer encouragement and support. You can also help them find a doctor, a healthcare professional, or mental health professional. If you know that people are in a danger to themselves or others and have very strange interests, as in sexual aggressions, jealousy, and similar emotions, or they don't have food, clothing, or shelter, you may need to call the emergency responders for assistance. A mental health professional needs to evaluate them, not you. Some people may need an emergency stay in a hospital which is specially designed for the purpose. Legalities and laws and mental health treatment against a person's will may vary by state and the country. You may contact community mental health services or agencies and even the police department in your area for more details. Unusual suicidal thoughts and behaviors need also be considered. The thoughts, like self-harm and attempts, are much higher than average in people with schizophrenia. If a person that you see and know is in danger of suicide or has made a suicide attempt, such as cutting their arms or some parts of their body, make sure that person stays with the other person. You most certainly need to contact a suicide hotline, such suicide and crisis lifelines, which are available 24 hours a day, 7 days a week. You may need to use a lifeline chat services if available, which are usually free and confidential. Remember, a proper medical treatment of schizophrenia can reduce the risk of suicide. Let's talk a little about the causes now. The current fact truly is not known what causes schizophrenia. However, the researchers believe that a mixture of genetics and brain chemistry and the environment can play a role. Even the people being befriended with such may make it worse by having no idea how to deal with it. Changes in certain naturally occurring brain chemistry, including neurotransmitters, which are known as dopamine and glutamate, may play a part in schizophrenia. Neuroimaging studies show changes in the brain structure and central nervous system of people with schizophrenia. While researchers have not yet been able to apply these findings to new treatments, the findings display that schizophrenia is a brain-related disease. Risks and risk factors. Let's talk about that. Although the cause of schizophrenia is not well known, these factors seem to make schizophrenia more likely. A family history to begin with. Life experiences such as living in poverty, stress and danger. Some pregnancy and birth issues such as not getting enough nutrition before or after birth, low birth weight, and exposure to toxins and plastics or viruses before both, which may affect brain development with the infants. Taking mind-altering, also called psychoactive or psychotropic drugs as a teen or young adults. And now let's look at the complications. When left untreated, schizophrenia can lead to severe problems which affect every area of life. Complications that schizophrenia may cause or be related to may include suicide attempts and thoughts of suicide, anxiety disorders, excessive jealousies, obsessive compulsive disorders, also known as OCD, depression, which is constant, misuse of drugs and alcohol, including nicotine addiction, not being able to work or attend tasks, even attending the school when young. Problems with homelessness, living on the streets, begging, or unusual sexual appetites. Social isolation. Health and medical problems. Feeling victimized. Aggressive and violent behaviors, though people with schizophrenia are more likely to be assaulted than assaulting others. Prevention. There is no certain way to prevent schizophrenia. However, staying with patients' treatment plans can help stop symptoms from returning or getting worse. Research shows that learning more about risk factors for schizophrenia may lead to earlier diagnosis and earlier treatments. Professional diagnosis is a must. Diagnosis of schizophrenia rules out other mental health conditions, and making sure that symptoms are not due to substance misuse, medicines, or other medical conditions. Discovering the diagnosis of schizophrenia. Physical exams. This may be done to rule out other problems that could cause similar symptoms or check for any related complications. Tests and screenings. These may include examinations that help rule out conditions with similar symptoms and screening for alcohol and drug uses. A healthcare professional, a doctor, also may request imaging studies like an MRI or CT scans. Mental health evaluation. A healthcare professional or mental health professional checks the mental stages by noting how a person looks and behaves, and asking about thoughts, moods, delusions, hallucinations, substance use, and potential for violence or suicide attempts. This evaluation includes family and personal histories. Treatments. A lifelong treatment with medicines and psychosocial therapy can help manage schizophrenia, though there is no real cure for it. These treatments are continually needed even when symptoms ease. Some people may need to stay in hospital during a crisis if symptoms are severe. A psychiatrist, particularly experienced ones in treating schizophrenia, usually guides the treatment. The treatment team also may include a psychologist, social worker, psychiatric nurse, and a case manager to coordinate the care. The full team approach may be available in certain clinics with expertise in schizophrenia treatment. Medications. Medications are the main schizophrenia treatment. Antipsychotic medicines are the most prescribed drugs. They are thought to control symptoms mainly by affecting brain's receptors for different neurotransmitters or chemical messengers. Many antipsychotic medications act on dopamine and serotonin receptors. A new antipsychotic drug, xanomeline and trospium chloride, is now known to affect the acetylcholine or acetylcholine receptors. The goal of treatment with antipsychotic medicines is to manage symptoms at the lowest possible dose. to get the desired result. Healthcare professional or a mental health professional may try different drugs and combinations of drugs and different doses over time. There are also other medicines which may help, such antidepressants, mood stabilizers, or anti-anxiety drugs. It can take several weeks to see whether the medicine helps the symptoms to get better. Because medicines for schizophrenia can cause side effects like many other medications, people with schizophrenia may not want to take them. A psychiatrist must monitor for side effects and in some cases may order blood tests. Medication choice may be guided to avoid certain unwanted side effects. Therefore, one may need to inquire through the healthcare professionals about the benefits and side effects of any medicines that are being prescribed. Antipsychotic medications can be classified as either first generation or second generation. Usually, the second generation antipsychotic medicines may have fewer side effects, often related to muscle movements. This includes tardive dyskinesia, which may cause repetitive and involuntary movements, such as grimacing or making faces, eye blinking, and other movements. Tardive dyskinesia may remain permanent. Second generation antipsychotics. The newer second generation medicines available is in a pill or capsule format include aripiprazole or Abilify, azathioprine or Suppress, first generation antipsychotics, chlormazole, flormazine, haloperidol or Haldol, piperazine or Trilafone. Long-acting injectable antipsychotics are available. Some antidepressants or antipsychotics may be given as a long-acting shot in the muscle or under the skin. They usually are given every 2 to 4 weeks, but sometimes less often or more depending on the severity. One may need to inquire by the healthcare professional for more information on those shots. This may be an option for people who prefer fewer pills to swallow, or if they are unable to tolerate them. Also, shots may help people stay with their treatment plans. Common medicines that are available as shots include aripiprazole or Abilify Maintainer, Abilify Asymptophene, Aristora, flufenazine deconate, haloperidol deconate, paliperidone Invega Cystina, Invega Trinsa, Invega Hapiera, risperidone, Risperdal, Consta, Penseris, or there are some others. Let us also make mention of psychosocial interventions in here. Even though the symptoms eventually may appear to get better, or continuing to take medicine is still important. It is also important to take part in psychological and social or psychosocial treatments, including individual therapies, talk therapy, also known as psychotherapy, may help improve patterns of thought, as well as learning to cope with stress and identify early warning signs of the return of symptoms can assist people manage their illness. Social skills training. Let's focus on making communication and social interactions better, and so making people with schizophrenia better able to take part in daily activities. Family therapy. During this therapy, families learn how to deal with schizophrenia. They also get support. Vocational rehabilitation and supported employment. This counseling focuses on helping people with schizophrenia to prepare for finding and keeping jobs. Most people with schizophrenia need support in daily life. Many communities have programs to help people with schizophrenia with jobs, housing, self-help groups, and crisis situations. A case manager or someone on the treatment team can help find resources. With the right kind of treatment, most people with schizophrenia can manage their illnesses. Hospital stay. During crisis periods and at time of severe symptoms, people may need to stay in a hospital for their safety. Staying in a hospital also makes sure that they eat right, get enough sleep, and bathe or shower regularly. Electroconvulsive therapy. Healthcare professionals or doctors may consider electroconvulsive therapy or ECT for adults with schizophrenia who do not respond to drug therapy. Electroconvulsive therapy or ECT is a procedure done with medicine that puts the patient to sleep, called general anesthetic. While the patient is asleep, small electrical currents are passed through the brain, causing a therapeutic seizure that lasts 1 to 2 minutes. ECT also can help people with depression. Coping and support. Coping with a mental condition as serious as schizophrenia can be hard for people with this condition and their friends and families. Here are some steps that may help. Build strong relationships with members of your treatment team. In fact, it may be a must. Working closely with your healthcare professional or doctor, mental health professional, and other care team members that makes one better able to fully take part in and benefit from treatment. And so, learn about schizophrenia. You see, education about this condition can help you understand how important it is to follow the treatment plan. Education can help friends and family learn more about the condition and be more compassionate towards those who have it. Get more sleep if you are the patient and having trouble sleeping, and know that lifestyle changes can help. Stay focused on goals. Managing schizophrenia is an ongoing process. Keeping the treatment goals in mind can help one stay motivated, manage the condition, and work towards one's goals. Use of alcohol or any drugs. Using alcohol, nicotine, or recreational drugs can make it worse or hard to treat schizophrenia. Indeed, quitting can be hard. Therefore, it is important getting advice from the healthcare team and how best to quit. Ask about social services. These services may be able to help with affordable housing, for instance, or transportation and other daily activities. Learn relaxation and stress management. Stress management techniques such as meditations, yoga, Tai Chi may help oneself and one's loved ones. Join a support group. Support groups can help you reach out to others facing the same types of challenges. Support groups also may help family and friends cope. You may need to go with your loved one to the appointments with the doctors. Doing so will help you know what your loved one is facing and how one can be helped. For schizophrenia, one can ask the healthcare professional, the doctor, some basic questions. What could be cause for these symptoms or condition? What are the possible causes for the symptoms or the condition? What kind of tests are needed? Will my loved one, my husband, my boyfriend, girlfriend, be affected by this condition for a long time? What is the best treatment? What are the options for the main approach you are suggesting? How can I help and support my loved one, my boyfriend, my girlfriend, or my husband? Do you have any brochures or other printed material that I can take with me? What websites do you recommend? Do not hesitate to ask any other questions during this appointment. What to expect from your doctor? Well, the healthcare professional, your doctor, is likely to ask you also several questions. Preparing for some of these questions can help make the discussion more useful. He or she may ask you, what symptoms does your loved one, your boyfriend, husband, wife, have? And when did you first notice them? Has anyone else in your loved one's family been diagnosed with schizophrenia? Do symptoms occur some of the time or all the time? Has your loved one, boyfriend, girlfriend, your son, boyfriend, or whatever, whoever, or talked about suicide? How well does your loved one do in daily life? Is your loved one eating regularly, going to work or school, and bathing or washing regularly, changing clothes? Has your loved one been diagnosed with other medical conditions? What medicines does your loved one take? The healthcare professional or mental health professional will ask more questions based on responses, symptoms, and, of course, needs. Remember, schizophrenia changes how a person thinks and behaves. The condition may develop very slowly. The first signs can be hard to identify as they often develop during the teenage years, not suddenly. Symptoms such as becoming socially withdrawn and unresponsive, or changes in sleeping patterns can be mistaken for an adolescent phase. People often have episodes of schizophrenia during which their symptoms are particularly severe, followed by periods where they experience few or no symptoms. Severe ones are known as acute schizophrenia. Symptoms of schizophrenia are usually classified into positive and negative groups. Positive groups: any change in behavior or thoughts, such as delusions or hallucinations. Negative ones: people appear to withdraw from the world around them, take no interest in everyday social interactions, and often appear emotionless and flat. Hallucinations: they are where someone sees, hears, smells, tastes, or feels things that do not exist outside their mind, and nobody else hears and sees them. The most common allocation is hearing voices when there is none. Hallucinations are very real to the person experiencing them, even though people around them cannot hear their voices or even experience the sensations. Research using brain scanning equipment shows changes in the speech areas in the brains of people with schizophrenia when they hear voices. These studies show the experience of hearing voices are a real one, as if the brain mistakes thoughts for real voices. Some people describe the voices they hear as friendly and pleasant, but more often they are rude, critical, abusive, and particularly, in a sexual sense, annoying. Those voices might describe activities taking place, even discussing the horrific thoughts and behaviors, giving instructions, or talking directly to the person. Delusions? Well, a delusion is a belief held with complete conviction, even though it is based on a mistaken, strange, or even unrealistic views. We must not confuse imaginations with delusions. Some people develop a delusional idea to explain a hallucination they are having. For example, if they have heard voices describing their actions, they may have a delusion that someone is monitoring their actions. They are constantly in panic mode, as if they are about to be attacked, or there are those who are making use of their wives or girlfriends or boyfriends as if sexual partners. Someone experiencing a paranoid delusion may believe they are being harassed or persecuted. They may also believe being chased, followed, or watched, as well as plotted against or poisoned. They may even consider a family member or a girlfriend, boyfriend. And some people experiencing delusions find different meanings in everyday events or occurrences. They may believe the people on television, all the newspaper articles are communicating messages to them, and they are hidden messages in the colors of cars passing on the street. Even the pets, animals, cats and dogs, they have usually confused thinking and confused speech patterns. Experiencing psychosis often have trouble keeping track of their thoughts and conversations. People sometimes describe their thoughts as misty or hazy when this is happening to them. Thoughts and speech may become jumbled or confused, making conversation difficult and hard for other people to understand. Some even describe their thoughts as being controlled by someone else, even by angels and gods, that their thoughts are not their own, or that thoughts have been planted in their minds by someone else. Some people even feel their body has been taken over and someone else is directing their movements and actions. Those kinds of feelings and confusion may lead to a person's behavior becoming more disorganized and unpredictable, and in fact, very dangerous. Symptoms during those negative times can often appear several months and years before somebody experiences their first acute schizophrenic episode. Negative symptoms experienced by people living with schizophrenia can be not wanting to look after themselves and their needs, such as not caring about their personal hygiene. Feeling disconnected from their feelings or emotions. Wanting to avoid people, including their friends. The negative symptoms of schizophrenia can often lead to relationship problems with friends and family, as they can sometimes be mistaken for deliberate laziness and rudeness. There you have it. This is schizophrenia, which is not truly treatable but can be managed. We will meet you again by the next episode. Keep smiling and be happy. Thank you.